Chlorphenamine. Imagine taking a simple allergy pill and, without realizing it, your brain starts working slower, your reflexes decrease, and even your breathing can be affected if you combine it with the wrong medication. That's what chlorphenamine is like, a drug so common that most people use it to treat allergic reactions, rhinitis, and conjunctivitis. But remember, it's a very potent drug that can change the way your body and mind function in a matter of minutes. Today you'll discover what chlorphenamine is, what it's used for, what happens in your body when you take it, whether there are any positive or negative reactions, and what the side effects of chlorphenamine are. You'll also learn about contraindications and when this medication shouldn't be taken. We'll also discuss interactions with other drugs. Is it advisable to take chlorphenamine during pregnancy or breastfeeding? What interactions does it have with alcohol? Don't stay in doubt. Stay until the end of the video to find out all this and more. We are the Guam E Project. Let's begin. First, let's define what chlorpheniramine is and what it's used for. Chlorpheniramine is a first-generation H1 antihistamine that blocks the action of histamine. What is histamine? It's the chemical histamine our body produces when it comes into contact with an allergen, causing symptoms such as itching, a runny nose, sneezing, and even watery eyes. By blocking histamine, it prevents histamine from binding to its receptors on the body's cells, thus preventing the aforementioned symptoms. What is chlorpheniramine used for? This medication is used to treat conditions such as allergic rhinitis, including fever. Chlorphenamine is also used to treat allergic conjunctivitis, where the person will experience eye symptoms. It is also quite helpful for the symptomatic relief of the common cold. But be aware this medication will not cure the infection. It is sometimes used as an adjunct for nausea and vomiting, and in emergencies, generally as part of allergy management. You might wonder what effects chlorphenamine has on the body when you take the pill. Well, we need to understand that it has an H1 antagonistic effect, which means it will reduce the effects of sneezing and watery eyes. It will also have an effect on the central nervous system. As a first-generation antihistamine, it will cross the blood-brain barrier and produce sedation, drowsiness, and decreased alertness. It will also have an anticholinergic effect, which means there will be a mild to moderate muscarinic blockade, resulting in dry mouth, blurred vision, constipation, and urinary retention in susceptible individuals. We need to understand that even in high doses, or in overdoses, the person can manifest agitation, confusion, tachycardia, seizures, or, in the worst cases, respiratory depression. What is the recommended dose of chlorpheniramine? Well, you have to keep in mind that this must be adjusted according to the commercial presentation and the age of the person taking it. You should always follow the instructions in the package insert. In adults and adolescents over 12 years of age, it is recommended to take 4 mg of chlorpheniramine orally every 4 to 6 hours. Note that you should not exceed 24 mg per day. This also varies considerably depending on the presentation. It can be in tablets or syrup. In children from 6 to 12 years of age, typically 2 mg every 4 to 6 hours maximum. You must always follow medical instructions because you should never self-medicate. What are the side effects of chlorpheniramine? Well, some side effects are more common than others. The most common are drowsiness, dizziness, and fatigue when taking chlorpheniramine. There is also an anticholinergic effect, which can cause dry mouth, blurred vision, and constipation, and as we mentioned, it is done. Urinary retention is a common side effect. What are the less frequent or serious side effects? These include tachycardia, orthostatic hypotension, and confusion, especially in the elderly. They can also experience allergic skin reactions and seizures, and this risk increases with overdosing. What about the elderly? There is an increased risk as they may experience falls, cognitive decline, and cumulative anticholinergic effects. keep this in mind. What are the contraindications for taking chlorphenamine? If you have a known hypersensitivity to chlorphenamine or any of its components, I advise you to discontinue use and consult your doctor for an alternative treatment. What about during breastfeeding and pregnancy? The literature indicates that we must be very cautious, as chlorphenamine can pass to the baby through breast milk, which is a contraindication. Patients with angle closure glaucoma may reach a state of tener una obstrucción urinaria grave, una hiperplasia prostática significativa, or ilio peráltico. No debes usar este fármaco as a la ligera. Debes consultarlo siempre con tu médico especialista, porque recuerda que debemos usar con precaución todo fármaco que se nos ha recomendado. ¿Tiene alguna interacción con otros fármacos? La chlorphenamine se menciona que tiene interacción bastante con depresores del sistema nervioso central como el alcohol, las benzodiazepinas, los farmacosupicios sedantes, lo cual van a potenciar la somnolencia y el riesgo de que la persona manifieste una depresión respiratoria. Es por eso que se recomienda no mezclar con cualquiera de estos fármacos. ¿Qué sucede con los inhibidores de la monoaminoxidasa? Pues pueden potenciar efectos anticolinérgicos y sedantes si se combinan con la chlorphenamina. Es por eso que se aconseja suspender el uso combinado. Respecto a los antidepresivos tricíclicos, pues antipsícticos y otros anticolinérgicos, se ha verificado que aumenta el efecto anticolinérgico. ¿Qué quiere decir? The person may experience confusion and urinary retention. And what happens with the medications that affect heart rhythm, such as antiarrhythmics? Extreme caution should be exercised, especially with overdoses in specific situations that can increase the risk of arrhythmias. With other similar antihistamines, when used in combination for a cold, the dosage and potential effects on the individual should be carefully considered, as not everybody is the same. Symptoms can manifest differently, and that's when you should consult a specialist to monitor your progress with chlorphenamine or any other antihistamine. What is the correct way to take chlorpheniramine? Generally, chlorpheniramine is taken orally. In tablet, syrup, or capsule form, capsules are less common. It should be taken with water and not with food. What is the correct way to take it step by step? You should follow the instructions on the label. Many cold preparations sometimes combine chlorpheniramine with other medications such as acetaminophen, phenylephrine, or dextromethorphan. You should keep in mind that you shouldn't mix products. Similar medications are used to avoid overdosing. You must also respect the intervals between doses. As mentioned earlier, you should wait 4 to 6 hours between each dose. One of the most important things is that you should not mix it with alcohol, as chlorphenamine causes drowsiness and alcohol can multiply its effect. If you are someone who likes to drive or operate machinery, you should keep in mind that chlorphenamine can decrease reflexes and concentration. Now, what happens if I forget to take a dose? Take it as soon as you remember, unless it's almost time for your next dose. In that case, don't take a double dose. Also, don't prolong the use of chlorphenamine. What do I mean by this? You should only take it for as long as necessary to control your symptoms. Its typical use is generally 2 to 5 days. Should I take it with food? Well, it's generally not necessary, but in sensitive individuals, taking it with food can reduce gastric discomfort, so keep in mind that not all organisms function the same way. What will those be? Signs that you should stop using chlorphenamine? If you experience difficulty breathing, confusion or disorientation, strong palpitations, allergic reactions, or even extreme drowsiness, you should stop taking the medication and discuss these symptoms with your doctor. With all this in mind, we now understand that chlorphenamine is quite helpful for allergic rhinitis, sneezing, runny noses, mild congestion, and itchy noses. It is useful for both seasonal rhinitis, such as when the person has pollen allergies, and perennial rhinitis, where the person may be in contact with dust mites, dust, or pet dander. What about allergic conjunctivitis? It is particularly helpful for red, watery, and itchy eyes. It helps with general symptoms, but it does not replace the eye drops prescribed by a doctor. It is also very helpful for allergic urticaria, especially for hives, where the person develops intensely itchy welts on the skin. What chlorphenamine does is reduce itching, inflammation, and the number of hives. We have mild allergic reactions to food or medications. People generally experience itching after consuming a certain food or medication. They may also experience skin redness and slight swelling without respiratory distress. Keep in mind that you shouldn't use it as the sole treatment for severe allergic reactions. Finally, we have mild contact dermatitis, which can manifest as itching from contact with irritants or sensitizers, generally plants, soaps, or chemicals. Chlorphenamine is a key aid in relieving itching in this case. So, now you know more about chlorphenamine, a proven and useful antihistamine for relieving allergy and cold symptoms. But remember, this drug is not harmless. Its ability to cross the blood-brain barrier produces drowsiness and anticholinergic effects. These can be dangerous if misused, especially in the elderly. Be aware that mixing it with alcohol or certain medications, or using it excessively, can have negative effects on your health. Organism. In modern clinical practice, many patients benefit more from second-generation antihistamines, which are less sedating when the goal is to prevent loss of concentration. If you are going to use chlorphenamine, follow your doctor's recommended dosage, check for interactions, and consult your healthcare professional if you are pregnant, breastfeeding, or taking other medications. Safety and clear information are the best medicine. I invite you to subscribe to the page and like the video. I encourage you to share it with other friends or family members who are currently taking chlorphenamine so they can learn about its current positive and negative effects. My name is Dr. Taj. We'll see you in other videos. We are the Sibtaj Project. Thank you very much.